Dr. Nikko is here with us, a cosmetic surgeon from Houston, Texas, to answer some questions regarding tummy tuck procedures. Hi, Dr. Nikko.
Hi, everybody.
Okay, our first question comes from Helen. She wants to know, what is the difference between liposuction and a tummy tuck?
I believe one of the most difficult question for patients to answer when it comes to dealing with their abdominal area is, do I need liposuction or do I need a tummy tuck? Liposuction is basically the removal of fat through suction, and like the term liposuction. And we do it with a small instrument basically called cannula. And we go in and we use a non-invasive technique where we use tumescent fluid. And then after the tumescent fluid, we basically use a cannula to suck out the fat. Now, a tummy tuck is when we actually go in and we excise out the fat and the skin and tighten the abdominal muscle. So in essence, you're basically thinking, okay, is it more of, do the patients have more fat and their skin is good? So that's liposuction. Tummy tuck is for people who have just an extra amount of fat, but also a loss of elasticity in their skin, or they have excess skin.
That makes sense. Thank you, Dr. Nikko. Our next question is from Marilyn, who says she wants a tummy tuck but is concerned about scarring. How big of a scar is it going to leave?
Yeah. How big of a scar means we can talk about the length of the scars and we can talk about the thickness of the scar. Now, in a full tummy tuck, the way that I do my tummy tuck, I do a lot of liposculpting with it. So what I do is most people have stubborn fat around their waistline. And what a lot of surgeons do is they tend to go around the back to remove that stubborn fat with a tummy tuck, excising it out. What I do is I actually use liposuction to create that waistline, to reduce that waistline, and to get that skin to shrink in so I can keep my incision shorter. Now, the incision is still one side of the hip to the other, but it's not like, it doesn't go around. It just stays toward like in the front for most of my patients. With that said, if you have a lot of skin, then I have to, of course, make it longer. Essentially, the more skin I have to remove, the longer the scar has to be. We all want a small scar, but if we have a lot of skin, then we have to extend the incision to excise out the removal of the skin. Because ultimately, you are going to have a scar. Would it be this long or this long? The difference is really not that much. What patients really want after a tummy tuck is they want their stomach to be tight. And if you try to keep the scar too small, then you can't excise out as much skin. And then they come back and they say, well, what's the point of getting a tummy tuck if my stomach is not as tight as I want? So that's what we have to work with patients. And then the other aspect is the thickness of the scar, and that varies from one patient to another. Genetics, how well they take care of their scar, their general health, and of course we have a lot of wonderful things now to really help, make scars look really small. We have a lot of treatment options. Half of my patients have darker skin type, so I have a lot of treatment options for those patients to really keep the scar as fine as possible.
Okay, next we have a question from Stephanie, who is a flight attendant and would like to know, if I get a tummy tuck, how long will it be before I can go back to work?
Yeah, believe it or not, we live obviously in Houston and took care of a lot of flight attendants from back then United, now United, and obviously those flight attendants, they work a lot. They lift heavy luggages and they do a lot of stuff. So that's a little bit different. Now with that scenario, on average, I would say about a month. Now for the average patients who has desk work, I would say about a couple of weeks. It's what's really what I recommend taking off. Now they're not going to be 100%, but they're well enough to kind of go back to work and do their desk work and do their other work. And so that's on average.
This next question is from Marie. Can I get pregnant again after the surgery? And if so, how does this affect the tuck?
I have had most of my patients decide to get a tummy tuck after they have had all their kids. But there's, of course, there's accidents. So I've had 3 patients that I know of that have had accidental pregnancies and childbirth after having tummy tucks. And to my surprise, again, it depends on how much weight you gain, genetics, how well you take care of yourself. But the 3 patients that I know of that got pregnant afterwards, I would say they retain 85% of their results, and it's pretty amazing.
I'm sure a lot of women will be happy to hear that. This next question is from Julia, and she wants to know, what do you charge for a tummy tuck?
Yeah. Now, obviously, we all comes in different size. So the bigger the tummy tuck, the more cost. And so it varies. If you're talking about just, because the majority of my patients, they don't have just the loose skin. I mean, they have the wrinkly skin, but they have stubborn fat too. And so we have to deal with that. But if you're talking about just simple, just skin, I mean, you could be, but you're still looking at starting out at $6,000. But if you have fat deposit in certain area, then you add liposuction to it. So the cost will depend on how much liposuction we have to do to get the results the patients are looking for. And ultimately, it is that how much it will cost depends on what kind of results you're looking for.
Becky wants to know, how many tummy tucks have you performed and how long have you been doing them?
Yeah, so I've been in practice for 15 years. And 15 years ago, we started out doing small tummy tucks, and now we're doing a lot bigger tummy tucks. And it's still outpatient. Our patients do very well going at home. No hospital stay required, and they do very well. And tummy tuck is probably the 3rd common procedure that I do. I do a lot of body work. So on average, I probably do, 1 tummy tuck at least a week. Sometimes every other week, so we do quite a few tummy tucks.
This last question is from Beverly, who asks, I'm probably a bit older than most of your client base. Is age a factor in what you can do for me? And if so, how?
Yeah. You'd be surprised that I'm seeing older and older patients get tummy tuck because we're living, longer and longer, and people want to look good into, I see patients 50, 60 going in and get tummy tuck. And so age is not really a determining factor because it really determines on the health of patients. A lot of these patients take great care of themselves. And if you take good care of yourself, you're healthy, there's no reason why you can't have a tummy tuck and look great for another 20, 30 years. Yeah.
Well, thank you so much, Dr. Nikko, for taking the time out to answer these questions about tummy tuck procedures. Oh,
my pleasure. And if you have any questions regarding what's right for you and, tummy tuck, liposuction combination, seeing the patients in the office is the best way to give you the best insight. So you're interested, give us a call, 713-960-1311, and I'd love to see you.
You can also scroll down to the comments section of this video to ask any further questions you might have, and Dr. Nikko will answer those for you as well.